Pregnancy and birth-related deaths increased during the first year of the coronavirus pandemic. According to a new report from the National Center for Health Statistics, the number of maternal deaths rose 14% in 2020. The data reveals that roughly one-third of the pregnant women and new mothers who died during 2020 were Black.
Additionally, the maternal death rate was roughly 3 times higher for Black women than it was for white women over the 12-month span. Let's bring in Shannel Pearman and Dr. Rachel Hardeman. Shannel nearly died of pregnancy-related complications, and Dr. Hardeman is the director of the Center for Antiracism Research for Health Equity. Thank you both for joining us. So, Shannel, tell us about the moment that you knew something was wrong during your pregnancy.
Yes, you see, the crazy thing is most of my pregnancy was beautiful, and I had an uncomplicated pregnancy, and it was a joyous time for my family. And it wasn't until the last week of my pregnancy that I noticed something wasn't right. And I started having symptoms that were concerning. And I expressed my concerns to my doctor, and my concerns were dismissed.
Dr. Hardeman, if you could talk a little bit about what Shannel may have been experiencing and what the condition is and what we know about what might cause it.
Right, so we know a lot, but we also have a lot to learn about what causes poor health outcomes or adverse outcomes for Black birthing people and birthing people of color. The issues are complex, and we have this added layer now of the impact of COVID-19 on pregnancy and childbirth. So there's issues related to first access to care, right? So we see that some birthing people aren't able to get the care that they need, or, over the past couple of years, it's only been by telehealth. We also see that for Black birthing people in particular, and other birthing people of color, that they're not listened to, that they're not heard. As we just, heard in this story, right, that their concerns are dismissed when they are talking to their doctor or other providers about what's going on with their pregnancy. And we also see that for people of color, birthing people of color, that they're facing a lot of other issues in their lives. And what we don't realize all the time, but what the data are showing us, is that there's this wear and tear on the body that is leaving pregnant people sort of less healthy and in less ideal of a condition to give birth.
Well, Shannel, we know from the evidence that there are these disparities in how it is that patients are treated. So what went through your mind when you said your doctor actually dismissed your concerns?
At first, I didn't quite understand. This was my first pregnancy. I was a first-time mom. So I kind of struggled with listening to my body. I knew something wasn't right, and I expressed my concerns to my doctor. But I thought, the medical professional, they would know if something was wrong. Maybe it's just me being a first-time mom, being nervous, overthinking things. And I started to second guess myself in that moment when, I should have advocated more, even though I pushed quite a few times and tried to talk to my doctor about my concerns to try to see what we can do. And, multiple times I was dismissed. So that is the very unfortunate part in this. But, I feel like so many moms, especially first-time moms, you may second guess yourself, especially when dealing with medical professionals and wondering, is it just in my head? They should know the answers. They should be able to tell me if there's something wrong. And if they're telling you everything's okay, like in my case, I was told I was okay, my baby was okay. And unfortunately, that wasn't the case. 1 week after having my son, I ended up having a stroke and I almost died. So clearly I wasn't okay. And it's just really unfortunate that my concerns weren't listened to and I wasn't heard, because I felt as though if I was, then I would have had a different outcome.
Shannel, we are so glad that you are okay. I mean, pregnancy is scary in any case, particularly your first time around. I just had my first baby. Dr. Hardeman, it's astonishing that here in the U.S., maternal deaths at birth are so high in this country. Why do you think women of color in particular are more likely to die in pregnancy than white women?
So you're right. Maternal deaths in the United States are very high. In comparison, there's countries and nations like New Zealand where you see nearly zero maternal deaths. And we're the only industrialized nation that has a rising maternal death rate, which is incredibly concerning. And what we know is that the statistics driving those rising maternal deaths in our country are due to the disproportionate impact on Black birthing people or Black women, and the reasons for that are multifold. They're complex. We just heard from Shannel a very important story of both how she was second guessing herself. We are very much sort of conditioned to think about providers and physicians as the final expert and voice. And so if we're being told nothing's wrong, you're fine, of course, many folks are going to believe that. Why wouldn't you? We also have seen this phenomenon of Black women in particular not being heard and not being listened to, as we also just heard in the story, when they are voicing concerns. So even, folks as famous as Serena Williams, right, had to really advocate for herself in order to get the care she needed. And that's just one of many stories in our research. We have been documenting the levels of disrespect and mistreatment, women reporting that they have not been heard, and also women who say that when they do advocate for themselves, that they are deemed aggressive or that they have been told that they are being disrespectful in some way.
Hopefully change will come soon. Shannel Pearman, thank you so much for sharing your story. We're glad you're doing well. And Dr. Rachel Hardeman, thank you.
Thank you.